Hello and welcome back to Between Two Stethoscopes, your source for the physician assistant life from pre-PA to PAC. I'm Bree Marks, your host. One of the most common questions that we hear from people that are just getting into healthcare is, what's the difference between a nurse practitioner and a PA? Here to help us answer that question today is Jasmine Ford. She is a certified and practicing nurse practitioner who is working in critical care. So Jasmine, thank you so much for being with me today.
No problem. I enjoy it.
Can you just tell us, how did you get into medicine?
Well, I originally transitioned into medicine with my career in the Navy. I was a hospital corpsman for approximately 6 years, and then I decided I wanted to go to law school after getting a degree in political science and having a minor in biology. But law school really wasn't for me after the first semester, so I decided to transition into nursing just because everyone around me was a nurse or a nurse practitioner.
So that's what you saw, and anybody in your family in medicine?
Well, my sister is a practicing midwife, as well as a family nurse practitioner. She practices in 2 different states.
Wow,
yeah.
Good for her. So what has your clinical career been like so far, both with nursing and now as a nurse practitioner?
Well, as a nurse, I transitioned from working in the emergency department, which is very scary for a new nurse. And then I just migrated into critical care, and then I decided to do traveling for a while to just expand just my practice and my knowledge base. And then from there, I went from critical care and ER, just picking up different, contracts in travel nursing to just make sure that I'm able to do everything I needed to do as far as, pay your bills, as well as get the experience you need to in critical care and not lose your skill set in a certain area.
Absolutely.
Yeah. And then after travel nursing, I said, well, this is a great life, great money, but I want more. I want that knowledge. I want I was really hungry for it. So I decided to go back for a dual certification as an acute care nurse practitioner and a family nurse practitioner at the University of South Alabama.
You know a lot. You know a lot of stuff. So what were some of the challenges that you found going from bedside nursing to being a nurse practitioner?
I always tell the same story, which is my first day of practicums, where I had a physician who I was working alongside, and he was a great mentor, but he was telling me, okay, we're going to change this medication from this dose to this dose. And then I found myself walking to the pump to actually adjust the medication myself. And I'm like, hold on, I have to wait a second. I'm sitting here. I'm the nurse practitioner. He meant put the orders in the computer.
Right.
So I just had that experience with him. And then I said, okay, I have to be the one to put the orders in. I have to, build my confidence and my autonomy and realize when I speak, my words have power, over the patient's outcomes. So that was a big transition. And then actually, I'm very indecisive. So when I went to NP school and they were like, oh, you have to pick a specialty, I was like, I don't know what specialty I want to do. So let me do as many as I can at one time.
Right.
So I was like, let me get a dual certification so I can experience every population of patients as well as every different setting.
Okay. Has there been anything that you really enjoyed going from bedside nursing to provider?
I guess my biggest thing would be the autonomy. Actually having that sense of accomplishment, the critical thinking, i.e. I work in critical care, but the critical thinking where you're able to put your knowledge into action, and you're sitting there and you're like, oh, I thought of that, and this actually had a great outcome for a patient. So
yeah. And how do you handle any difference of opinion that you might have with your collaborating physician or other people on your team? Say you come up with a diagnosis and a treatment plan and your collaborating physician is like, no, I don't think we should do that.
Well, I really just walk through it with them, and we just dialogue. We go over all the evidence-based practice that we know and how outcomes basically are not always textbook outcomes when you implement any kind of medicine or treatment plan. So we go through, we talk about that, have intense discussions, and then we just come up with the best plan for the patient according to all our knowledge, and we just collaborate. I love that word, and I use it more in my charting every day.
Yes.
And it's collaborative discussions, because honestly, that's what it takes, a village,
I completely agree. And kind of bouncing right off of that, unfortunately, sometimes out in the world, there seems to be a little bit of competition between PAs and nurse practitioners and, just Unfortunately, not where we work. We're very lucky in that way.
Yeah.
I don't feel
Everyone's
that culture.
an advanced practitioner.
Absolutely, advanced practitioner, which I like that term. But how do you think that PAs and NPs can better support each other and collaborate together for the best care for the patient?
I think it all comes down to understanding that we're all here for the same reason, to treat the patient, and also understanding how each other, like how we got to the point where we are. We all went to school, you know, took different routes, of course, to become who we are in the medical field. And we just have to understand and have a better overall comprehension of like what the person had to do to become what they, you know, essentially, you know, are today, whether it's a nurse practitioner with a collaborative agreement or a physician assistants with a supervising agreement. At the end of the day, we all do the same thing.
I totally agree. Yeah. I think most patients don't know the difference.
They don't, honestly.
They don't.
You're the person who helped me.
Right,
Yeah.
Right. Hopefully that's the goal, right?
Yeah.
And just for our PAs and docs out there that don't really know what it's like to go through NP school, can you just walk us through the process a little bit? Like what's a normal path that somebody would take, like experience-wise, and then as far as getting through school?
Okay. Well, basically, you go to nursing school, get a 4-year bachelor's degree, and you transition into a master's program. After some schools require 2 years of experience. Some schools you can transition right into the school as long as you have been on that track before, as far as like working in critical care if you want to do acute care. But anyway, prior to entering a nurse practitioner program, you have to know what specialty you want to be in. Family nurse practitioners, you know, you can see pediatrics, but in a clinical setting, as well as adults in a clinical setting. You don't see that critical intubated patient. Acute care nurse practitioners, you'll see that intubated patient, but unfortunately you're unable to work out in the clinic section of medicine. You have to just be able to go through and make sure that the patient's doing okay in the critical care section of the hospital. And as far as like working as a hospitalist, you wouldn't be able to really go into that role altogether unless your hospital allows you to be credentialed. So a nurse will finish her program, pick a specialty, go through a master or a doctorate level program, and then graduate, take a certification in that specialty, only be able to work in that specialty by her scope of practice. I know a lot of nurse practitioners that want to tell you, please don't work out of your scope of practice because you're not covered legally.
PAs too. PAs too, so you know.
Yeah. So just make sure if you're a family nurse practitioner, you're working in the clinic with family patients. And I mean, they have pediatrics, family, acute care, primary care for only adults. I mean, it's all different types of, you know, subspecialties inside the specialties. And you're always welcome to go back further for additional training to gain another specialty as well.
Okay, thank you. That was really informative.
Yeah.
I learned a lot from that too. Well, what advice would you give to students that are thinking about pursuing the NP track?
Know your specialty. I'll just tell you, you know, stay strong during the course of the whole NP thing. Nursing school is very difficult. You know, every question is right. The best answer is the right answer. You just have to really just know what you want to do, unfortunately, before you start, and go through that course accordingly, and just try to take out everything you can. Work with docs, learn the medical model so that you're able to be successful outside of the NP program, not just the nursing model, where it's like, you know, we practice holistic care, you know, all those different things. And I feel like a lot of docs do as well. So just know you're going to be a part of a team. So you need to know how everyone got to where they are today, and understanding their past they took, so that you're able to appreciate them a little bit more.
Thank you. And I think that advice goes to everyone. That's really excellent advice, because, you know, every single person that is working in healthcare has struggled to get there. Everybody. And that goes for our respiratory therapists, our paramedics, our, you know, our nurses. Everybody on down the line has had some blood, sweat, and tears. So we should all be respecting each other.
Yeah. And I think we need to pull from them on a daily basis, because I am the queen of questions.
Yeah, I agree. There's so much to learn if you just like are open to asking.
Yeah, most definitely.
Well, thank you so much, Jasmine, for being with me today. I feel like I really learned a lot. I'm sure everybody watching really learned a lot from you, so we really appreciate your time. Oh,
my pleasure. I hope you guys all learned like a great deal, especially anyone going into the field of being a nurse practitioner. It can be challenging, but you have like your cohorts, like physician's assistants, to help you out along the way. I mean, those are your biggest assets, because they understand exactly where you are.
Yeah. Peers and colleagues.
Yep.
For collaboration.
Yep. Exactly.
Well, if you like this content, please like and subscribe, especially if you're on YouTube. You can also follow me for more frequent, almost daily updates on Instagram at Between Two Stethoscopes, and you can follow me on Facebook at Between Two Stethoscopes. We'll be back with a new interview soon. Thanks for tuning in. Bye-bye.